Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Team Needham Abode podcast studio. And we are super excited to have Kendra Johnson on our podcast today. And we're basically going to be talking about just whole body health. So much of the time in medicine now, we talk about specialists for your heart or specialists for your kidneys, but honestly, our bodies don't know the difference between different body parts, and they all work together as a whole. So that's kind of what functional medicine is, and just whole body medicine is. So, Kendra, welcome to our show.
Good morning. Thanks for having me.
Yeah. So tell us a little bit about your history and what you do now.
So I'm a nurse practitioner, and I actually started out as a dietitian, and worked that industry for a couple of years and realized that I needed to kind of deeper dive into teaching people how to eat. And so then I went to culinary school and ended up working in a bakery, ironically. I know that doesn't sound like it connects. But learning about food, how to cook food, how to incorporate it into people's lives. And then I went into nursing and midwifery and then wellness. And so I kind of have had a little bit of a journey getting here and finding health for people, alternative ways to do wellness and longevity.
So sometimes that journey starts with a personal health journey of our own. Did you have that same thing?
I did. I had an injury in 2010, and through kind of traditional ways, they told me that I would not work again and that I'd be on pain medication for the rest of my life. And that didn't feel like an acceptable solution for me. And so in my journey of other ways to heal ourselves, to build ourselves up, and to create wellness, I created my clinic.
Awesome. Janet, what questions do you have for Kendra?
Okay, Kendra. I know right now there's a lot of hub about losing weight. And so Shawn and I have been talking a lot in the last few months about inflammation. So with that, what are your thoughts about the journey that we're making with obesity and inflammation, and how's that impacting your clinic? Because I feel like that's a big topic right now.
It definitely is a big topic. And I think it is becoming more of a realization for people that they are impacted daily on inflammation, whether that's what we're exposed to in our food, our environment, stress in our life. Many things create inflammation in our gut and in our blood vessels, in our cardiac system, in our brain. And helping mitigate that is, changing our lifestyle, changing our focus on what we're eating, how we're eating, and how we're taking care of ourselves. I think that we haven't spent a lot of time teaching from a young age how to be preventative and how to take care of yourself and make choices for feeling your best.
Yeah, I will definitely echo with that. I think it just comes down to education. I think a lot of times we take for granted that, we've learned what to eat. What to eat is healthy, but I grew up learning that Kellogg's breakfast was healthy because that's what they advertised. That's what they promoted. And fortunately, that conversation is coming out now that those might not be the healthiest things for us.
I agree. And simplified foods. We live in a world of instant gratification and fast pace. And those foods fit in nicely. They're easy access. They're often less expensive than good whole organic foods. And it's not an easy task. I call it creating a new hobby a lot of times for people to refocus on eating well, eating whole, and eating for what your body needs.
It takes time to prepare good food. There's no doubt about it. And I think one of the major reasons for obesity is not necessarily just the food, although that can be a big issue for sure, but definitely the preparation of food. When it's easy to overeat when you don't have to prepare the food. But if you're making steak and eggs for breakfast and you eat it all and you're full, and you look at your watch and you say, well, I don't really have time to make any more, that might be okay. Whereas if there was some kind of frozen box of food that you could just throw in the microwave and make more of that took 2 minutes to warm up, you could overeat a lot easier.
I agree. I've also found with many people who have tried different solutions for weight loss is that often people undereat. So they have an idea on the calories in, calories out, which has validity, but that they minimize what they should be having. And they eat less and less in an effort to cut back and see what they can do. And over time, it might work initially, but over time, our body's metabolism puts a halt to it and doesn't feel like that's optimized. And so they begin to gain visceral fat and or not have the ability to lose weight. And so getting people to focus on the right amount of food for their body type, for their age, the season of life that they're in, their activity level, and what their nutritional needs are. Eating for deficiencies as well is important for getting everybody to have a active and healthy metabolism.
Yeah, for sure. And one thing I just stress is, and I think calories in, calories out is important. And I think everybody that starts a weight loss journey or just a health journey in general needs to probably start tracking calories with some kind of, there's all kinds of different mechanisms you can do that. There's nice apps and stuff. I like MyFitnessPal because I'm familiar with it. And then focus on eating towards your caloric goal or weight loss, and they'll figure out those numbers for you if you're honest on the questionnaire that you fill out. But then overall, I think once you realize I don't track my calories anymore because I know when I eat bad, so I don't, because I tracked it for so long. But one of the things is that if you eat real food, it's really hard to overeat.
I agree. I think you feel satisfied when you're eating, a well-rounded meal. We were just talking about this, actually, my other half and I, about how, we were on a trip and we went through a drive-through and we were starving the rest of the day.
Yep.
It just completely changed how my mind and my body reacted to food because I put in things that just weren't great for it, and weren't whole, weren't fresh. And we had cravings all day long. We wanted to stop, every hour or so on that journey. And we don't normally feel that way.
Yeah, isn't that true? So Janet, what other questions do you have for Kendra?
So Kendra, I know you have a whole body approach. So it's not just food that's causing illnesses. So let's talk about some other things that people can do in their lives that you address in your approach to their health.
Well, when we have people come in initially, we try and do, a full panel of a minimum blood work, but we also offer some deeper dive functional labs that help get at root cause. So we can do some gut analysis, some micronutrient testing. We can do urine testing to see if you have any heavy metals, pesticides, toxins, mold exposure, things that might be contributing to inflammation or difficulties with detoxification. We can do more genetic testing in oxidative stress, as well as methylation, to know better how to personalize diet recommendations, vitamin recommendations, and supplements so that we can really get at what is your deck of cards. What do you have that's special for you that we can modify to really optimize people feeling great? Sometimes they want to come in and they want it to be done in a month. But I remind people that it can take up to a year to balance everything because we have to start with one layer and then work our way out. So very often we start with the gut, and the gut is the gut's our brain, and the gut is how we feel. But we really try and begin there and then balance everything else.
Well, one thing I remind patients is that, when they want some kind of quick fix is that, and whether that be weight loss or just overall health in general, probably in most cases, they didn't just wake up one day and felt as horrible as they did and were sick. Now, there are cases that happens with a traumatic injury or, hysterectomy for one, with an oophorectomy. But in general, it takes years for that to happen. So to fix yourself in overnight or in a month is probably not very realistic.
I agree. And we didn't get there in a month either. Right. So taking time.
Yeah, absolutely. So talking about gut health, one of the things that I don't think people really understand, you talked about the gut being our brain. Will you go more in depth into that?
Well, the gut is where many of our neurotransmitters are made. It's where our vitamins are, processed. It's where many of the factors that we need to detoxify and methylate and absorb are all centered. Our emotions, our skin. So many people who suffer with acne have tried anything and everything as far as procedures, but we haven't addressed their gut balance. It's as simple as really understanding what's normal as far as having a bowel movement. So many people, we just don't discuss that when we're young. Is this normal? Are you balanced? How are you feeling? And it affects every cell and every part of our body.
Well, the reality of it is that, almost all of our nutrients come through macro and micronutrients come through our intestinal tract, so in our gut. So if we don't have a healthy gut, it doesn't matter how well we eat, doesn't matter how many supplements we take, they're not going to be absorbed optimally, and we're not going to get healthy.
I agree.
So tell us, what are some ways that you test gut health and help gut health?
We do a stool test initially. We run those micronutrient tests, tell me, even though your blood test might be normal, for example, for vitamin D, inside your cell, you could be very low. And we want to make sure that that is balanced and that the pathways are supported for getting it in and out of the cell. And so looking at within your stool sample, how much bacteria you have that's good and bad, and is it balanced? Do you have the right enzymes to break down your food? Are you chewing your food effectively? Or are you chewing too fast? Are you breaking down your fats? Do you have antibiotic resistant bacteria in there? Just as information, if you are being treated for something, is that an effective form of medication for you? Are we giving you the right probiotic? Are you taking a probiotic that you already have an overgrowth of that type of bacteria, even if it's a good bacteria? And then looking at those vitamins and what you are taking and what you're not taking and what your body actually needs for you.
It is really cool, the tools that we have nowadays to help us work towards optimal health. And those are some just good examples. But tell us more about the micronutrient testing. So what kind of nutrients are you testing for?
We're testing for 54 different vitamins and minerals. So everything from selenium, zinc, vitamin A, all of your B vitamins, so many that we don't think about: potassium, calcium, magnesium, manganese, that you may or may not be getting in your diet. How diligent you are about getting your greens, getting your fiber. And then if you are taking those, I've just in this week have had 3 people that take really great supplements and are eating really well, but the nutrients are not getting inside their cell. And they are coming with complaints of fatigue or not able to optimize their thyroid. And so by identifying these small nutrients that aren't getting inside the cell, we're making plans to maximize their detox pathways and give them vitamins that their particular genetics need, so that we can get those vitamins inside the cell and really move the dial on how they're feeling and how they're performing.
I love that. I love it. So Janet, what are the questions you have for Kendra?
Well, Kendra, of course, we have to focus a little bit on hormones since that's our thing. But I find so many clients, especially peri and menopausal, are just struggling with sleep. And so, Shawn and I, we hit their hormones, but nutrients actually can affect that too, right?
Yep.
So let's talk a little bit about what nutrients could be hitting them if they're not sleeping well.
if really balancing and optimizing your B12, your vitamin D, your magnesium, often vitamin A is an important part of that balance. When we're looking at traditional labs in medicine, a vitamin D level is often reported to the patient as normal when you have a blood value of 30 to 40. But really optimized is not 30 to 40, right? So getting that blood level up 60 to 90 is going to make it easier to balance their hormones, easier for them to sleep and absorb other nutrients because, vitamin D is a hormone itself. And getting everything optimized for that person with those solid lifestyle changes that they do long term. One of the things that I often hear is I tried it for 3 months, it didn't work, so I stopped it.
Right.
It definitely has to be something you try for at least a year. And vitamins, as we know in the Pacific Northwest, vitamin D is essential.
Yes, I agree with that statement. And when you talk about the lab levels, I don't rarely, unless somebody's supplementing, do you ever see a good level, especially because of our latitude. So I think that's a huge, huge part of it. And when Shawn and I are talking to people about their hormones, we've had people that we thought their hormones were balanced, but they still weren't feeling optimal. And it was one simple thing. It was their vitamin D. So certainly that is a big, big nutrient that we need to focus on.
It is. Go ahead.
Well, I remember a patient, and that might be what Janet's thinking of, or maybe she has an example of her own, but I remember a patient we worked with for a year to balance her hormones, and she was feeling better, but not optimal. And she says, oh, the best thing I did is, a few months ago, I started taking vitamin D, and that was the game changer. And I was like, I was embarrassed that I missed that. I mean, so we try not to miss that anymore, because like you say, vitamin D is a hormone in itself. It's got a cholesterol backbone, just like the sex hormones do. And it's important for it to be optimal. And I've never seen an optimal vitamin D in the Pacific North, in our area. Besides, that's not true. I've heard of a guy that he was a lawn care worker, and he worked outside with his shirt off all summer long. And he had normal vitamin D, but most of us don't work outside, and most of us don't, keep our shirt off all day, because we usually can't because of sun issues. That's a whole other story. But
I've also found with clients that I have in California and Arizona that do get adequate sun, that when their gut is not balanced, they're still not able to optimize their vitamin D. So, you can be a person who's in the sun. And I hear that often from clients that they, declined getting their vitamin D checked with their primary care for their annual visit because they say, oh, I'm in the sun all the time. But they may not be processing that. They may not be able to optimize it, whether there's someone genetically who needs 2 times the amount of vitamin D as someone else, or their gut flora isn't able to produce vitamin K, which helps them absorb it. So it can be a factor of many things.
And another thing is speaking of gut health and vitamin D, vitamin D is fat soluble in itself. So it can be more difficult to absorb. You need to probably take it with food or in a liquid supplement. I just say take it with food, and that's not always the most important thing, is you just get the optimal dose. But there are certain people that don't have good gut health. They can't absorb vitamin D very well, so they need super high doses of vitamin D. I've seen 50,000 units a day that somebody needed because she wasn't absorbing it very well. Now, she did live in Alaska also, so that didn't help, but there was an absorption issue too.
Right.
Janet.
Okay, so since I have women on my brain this morning, we've been talking to different people about pelvic floor. Do you do anything in your office about pelvic floor and refer people?
We have 3 or 4 practices that we refer to for pelvic physical therapy. We do offer optimization as far as I can do We have different kits for optimizing vaginal health as far as lubrication, making sure their hormones are balanced is super important for the tissues. But we also offer PRP injections for your pelvic floor. And very shortly in the next month, we'll be bringing on IV ozone, and then ozone, we can do several routes. We can do it rectally, vaginally, all of which optimizes the tissue elasticity, strength, and lubrication.
I love that. So tell us, what do you enjoy doing the most in your practice? What is your passion in your practice?
Oh gosh, I don't think I can pick. We joke around here that I really just enjoy the puzzle of figuring out that whole balance for people, not just one thing. So we do therapeutics, we do migraine, and often migraine is related to gut and it's related to vitamins. We do beauty around here. We do Botox and filler and laser, and making people feel amazing on the outside also requires them feeling amazing on the inside. So we love everything that we can do to really figure out what is needed for that person in particular. What is their puzzle and layers that they need, and what we can do to support it.
I love it. So I'm going to put you on the spot a little bit, Kendra.
Okay.
I know you have a multitude of stories, of success stories, but tell us one that comes to your mind first, a big success story that you've had that was just really, really a big success in your life and for the patient.
We have many, really, really, truly daily. But just this week, we had a patient come in who has been getting hormone therapy with us for about a year, and has also done some weight loss programs with us and some different optimizations. But she came in for her visit, and as she was leaving, she just broke down and cried and just said, I can't believe how much you have changed my life, but how much you've changed my marriage. And she had a marriage without intimacy for 8 years because her hormones were not balanced and she didn't feel herself. And getting all of that in line, the first couple months that she saw us with this year, her husband sent us flowers. And, we're 9 months out and she still is in tears on how much her life has changed and how she can have such a better relationship because she feels amazing.
We love hearing that. And of course, we specialize in hormones, and we hear those stories like daily. You changed my life, you saved my marriage. And that is so rewarding for us. And I can tell you, and you might be able to talk on this, because I think, you at one time worked in traditional medicine. But when we worked in traditional pharmacy, dispensing the typical blood pressure medications, cholesterol medications, we never got that. Nobody would come up to us and say, well, thank you for giving me my Lipitor for my cholesterol. Nobody would ever say that. Right. I'm being kind of sarcastic, but it's true.
It's true. Yeah, totally true.
It really is. It is, it's such an opportunity to look at the whole person and what their family and their lifestyle and their job contributes to the choices they're making, and trying to help them find that balance. When you're just giving someone a medication for a diagnosis, that's not including any of that. And it's really leaving them feeling like they don't have support or what to do. When you go in for a visit, often it's 10 minutes and you can't open the box of questions and concerns and really dig into what is the root cause or how could I make a change, and then following up to see what that looks like. Did it work? Did it not work? It just is. It's really rewarding to have the opportunity to see people for as long as I want, as often as I want, and have it not be the measure of the number of visits or the number of medications I prescribe, but really what are the improvements and longevity and quality that people experience instead.
Well, it's interesting you say that, because in traditional medicine, and Janet does not like that term because she thinks traditional should be what you're doing now and what doctors did 100 years ago. They look at the whole body, spiritual, mental, physical. But we have all these markers, whether it be, okay, if you've had a heart attack, you need to be on a beta blocker, you need to be on a statin. But none of them are outcome based. Right. Like you're saying, you had a patient come in and thank you for basically changing her marriage. That's an outcome. That's a big outcome.
Right.
And in traditional medicine, we don't have the medications that we prescribe on the checkbox are not usually outcome based. And if they are, they're published by the studies published by some drug company that wanted the outcome to be that way. But it definitely, in my opinion, is not just overall better health. I mean, it might have some kind of marker. Well, load your cholesterol from 220 to 180, but did it really make you any healthier?
I agree. And it may have been healthier by a measure that was done in a study that didn't include that person's genetics, background, body style. We're given these parameters that don't necessarily fit the box for everybody. And so those measures are hard.
Absolutely. Or on that subject of statins, the statin, I don't believe that statins decrease cardiovascular events. But let's just say that there are studies out there that show that they do, although when you look at absolute risk, it's a very small decrease. But they don't talk about that it caused the patient to have liver enzyme increases. It caused the patient to have muscle pain. It caused the patient to have long-term dementia. They don't mention those things. That's something that, is important when it comes to overall health.
Right.
Well, I agree.
One thing that I found, I was telling Shawn the story yesterday, is that I had a client that was referred to us, and really, if you have only 10 minutes, you're never going to figure out what this person is living in, or what their lifestyle is, or what they are dealing with day to day. And she is 39 and she has 6 children, and one is like maybe a year and a half. So her plate is full. And the answer that she got from her primary care was, well, you're depressed. Let's put you on an antidepressant. Well, how did they decide in those 10 minutes in that office that it was depression? Because really, if you listen to what she had to say and explain herself and what her lifestyle was about, it wasn't that. She was just exhausted. And it's sad to me that we put people in these boxes and give them prescriptions that really have side effects long term. I'm just thinking about how did that make her feel? She said, numb. I'm numb. I'm a mom of 6 and I'm numb. That's strange. And I'm like, so really getting to know someone, I don't think 10 minutes does the job. And Kendra, like you were talking about, is like, what's the underlying theme, or what's the underlying issue for this person? And how are you going to come up with the tools to help them if all we ever do is give them a pill to say, here, just numb yourself, you'll be better?
I agree. And often we're giving them, in 10 minutes, we might give them that medication and then 10 things to do and not follow up if those 10 things worked. Right. Can a person with 6 children do what you're asking them to do? Can they afford what you're asking them, to eat, or how to do it? I find that people give these absolutes to people and expect you to change your entire life in 1 month. And one, that's overwhelming for some people. They may not be able to afford it. They may not know how to incorporate, a woman who's cooking for a family of 7 may not be able to do healthy things for herself or for them without changing it in minute ways. What are small ways you can change the oil you're cooking with, the type of seasonings that you're using, the packaged food that you're buying? How can you make it doable that works for them, that will actually move the dial?
Yeah, you have to. It's just like with exercise, and of course, this, Kendra. You hear, well, you need to exercise 30 minutes a day, 4 times a week, and at a certain intensity in order to get all the benefits. So start doing that now. Well, if somebody is just coming from off the couch in a sedentary life, that's just not realistic, in my opinion. You got to meet them where they're at. And, and it might be just like, hey, after every meal, get up and walk for 2 minutes, literally. Start there. Yeah. And then progress from there.
I 100% agree. I talk to people about this, hormones and weight loss, that if we can make 1% change a month, that will snowball into giant change for the year versus trying to change 50% today. Because that might go for 6 weeks, and then something's going to happen in life, stress, vacation, where you can't keep it going, and then it's not sustainable. And so if you make change that's small, that sticks, that will be a life change over time, that you then 3 years from now are 50% healthier because you made a 1% change per month versus a 50% change that you couldn't sustain.
Exactly. Right. It's got to be sustainable, whether it be exercise, whether it be a way of eating,
Right.
you know, or it's not going to be incorporated into your life long term.
Right.
So Kendra, as we wrap this podcast up, I'm streaming your website here. Tell us a little about your website.
Awesome. Thank you. Our website is where you can find all of our services, a little bit about everything that we do. You can request an appointment there. We will get back to you via email, and just a little bit about our team. We're really excited. Everyone here is really dedicated to getting people to the place that they want to be, to live long and have really great quality of life.
Well, that's what it's all about. It's about, you know, helping patients, you know, live a good, long quality of life. And as we study more in, you know, anti-aging medicine or wellness medicine, you know, people are thriving into their 50s and 60s, 70s, no problem. But you have to put the right inputs into your body to make that happen.
I agree. You got to keep your body moving.
Yeah, that's exactly right. I mean, Janet has a story of her uncle a couple years ago, 92 years old, and he was on his horse branding cattle, as he did all the time. And the next day he woke up with a pneumothorax because he probably got kicked by a cow, and he died.
Oh.
92 years old, though. I mean,
Wow.
branding cattle. I mean, that's an amazing story. So when people say that, well, I'm 55, I'm too old or whatever, no, not even maybe.
Not even maybe. I agree. I want to wake up every morning and feel the age that my brain says I am, not my body.
That's exactly right. That's exactly right. So, well, Kendra, thank you so much for being on our show today. You helped us realize our goal, which is to educate and empower individuals to take charge of their own health. So thank you so much for being on our show, Kendra.
Thank you. You guys have a great day.
All right. Thank you. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday for a regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you.